Madam, now you can start, madam.
Good afternoon, everybody. Now we are discussing about vitamins. Am I audible?
Yes, madam.
Am I audible?
Yes, madam.
Okay. Vitamins are two types, fat soluble vitamins and water soluble vitamins. The water soluble vitamins are vitamin B and vitamin C. The fat soluble vitamins are A, D, E, K. Fat soluble vitamins are stored in the fatty tissues of the body and liver. Water soluble difference are ADEK, vitamin C and B is the biggest. Vitamin C and vitamin B is the water soluble fat. Sorry, B and C are the water soluble vitamins. Vitamin B is the biggest group of vitamins. We have to remember the names of the B type of vitamins. B1 means thiamine, B2 riboflavin, B6 pyridoxine, B12 cobalamin. You have to remember this. B1 thiamine, B2 riboflavin, B6 pyridoxine, B12 cobalamin. Coming to vitamin A. You have to remember in vitamin A what is the first sign of vitamin A deficiency and what is the first symptom of vitamin A deficiency. You have to remember this. Earliest symptom of vitamin A deficiency is night blindness. And the earliest sign is conjunctival cirrhosis. You have to remember this. Earliest symptom is night blindness. Earliest sign conjunctival cirrhosis. So many times we ask this question. Other symptoms are hyperkeratotic skin lesions, xerophthalmia, that is white spots. White spots are white patches of keratinized epithelium on the sclera. You have to remember this also. White spots on the sclera, and also night blindness and keratomalacia. First symptom is night blindness. First sign is conjunctival cirrhosis. Coming to vitamin D properties. It is good for strong bones and teeth. The signs of vitamin D deficiency are unhealthy teeth and osteomalacia. This osteomalacia in adults, rickets in children. Osteomalacia causes weakening of the bones. Coming to rickets. In children, failure of bone tissues to become properly mineralized, resulting in soft bones and skeletal deformities. And also causes tetanic spasms, developmental delay, cardiomyopathy, and dental abnormalities. Coming to vitamin E. Which vitamin is the powerful antioxidant means vitamin E. You have to remember this. Powerful antioxidant vitamin E. The deficiency of vitamin E are weak muscles and fertility problems. Weak muscles and fertility problems. also other type of question, which vitamin is used for fertility problems? Vitamin E is the answer. Vitamin E means tocopherol. Vitamin K. It is useful for blood clotting. Which vitamin is used in blood clotting? This is the question. Vitamin E is the answer. And also it is good for helps in protect your bones from fractures and help prevent postmenopausal bone loss, and it helps to prevent calcification of your arteries and provide possible protection against liver and prostate cancers. Bleaching of the food destroys the vitamin K, but heating does not affect it. You have to remember this. After bleaching, vitamin K destroyed, but not by heating. Coming to vitamin C. Citrus fruits, kiwi fruits, berries, tomatoes, cauliflower, potatoes, green leafy vegetables, and peppers are the main sources. The signs of deficiency are tiredness, gums, bleeding gums, slow healing wounds. It is destroyed by boiling food, light smoking, and heat. What the pathognomic feature of vitamin C deficiency is scurvy bursts. We have to remember this. The animal source of vitamin C is the liver. We have to remember this also. Pathognomic feature of vitamin C deficiency is scurvy bursts. And the animal source of vitamin C is liver. Corkscrew hair is also feature of scurvy. Woody leg is a feature of scurvy. You have to remember all these. Animal source of vitamin C is the liver, and scurvy bursts are the pathognomic feature of vitamin C deficiency. Corkscrew hair and woody leg is the features of the scurvy. Vitamin C also useful for wound healing. Which vitamin is used for wound healing? Vitamin C is used for wound healing. Which vitamin is a powerful antioxidant? Vitamin E is the powerful antioxidant. Vitamin K is used for blood clotting. You have to remember all this. Coming to vitamin B1. What are the signs of vitamin B1 deficiency? Tingling in the fingers and toes, confusion, difficulties in maintaining the balance, loss of appetite, exhaustion, and weakened powers of concentration. Pain and paresthesia also are symptoms of vitamin B1 deficiency. Due to B1 deficiency, the main disease is beriberi. You have to remember this. What are the types of beriberi? Wet beriberi and dry beriberi and Wernicke's encephalopathy. You have to remember all this. Wet beriberi due to in this cardiovascular symptoms are prominent. Enlarged heart, tachycardia, high output, congestive heart failure, peripheral edema. These are the symptoms of wet beriberi and dry beriberi. In dry beriberi, symmetrical peripheral neuropathy of the motor and sensory system, diminished reflexes of the legs. You have to remember this. Wet beriberi, dry beriberi, wet beriberi, cardiovascular symptoms are prominent. In dry beriberi, neurological symptoms are prominent. In Wernicke's encephalopathy, it is mainly vitamin B1 deficiency mainly seen in alcoholics. In this Wernicke's encephalopathy, horizontal nystagmus is the prominent feature, and also ophthalmoplegia, cerebellar ataxia, and mental impairment. You have to remember this. In alcoholics, vitamin B1 deficiency in alcoholics causes Wernicke's encephalopathy. In this horizontal nystagmus, ophthalmoplegia, cerebellar ataxia, and mental impairment are the prominent symptoms. Loss of memory and confabulatory psychosis is called Wernicke-Korsakoff syndrome. It is also very important. Coming to B2. Because of B2 deficiency, B2 also called riboflavin. B1 means thiamine. B1 thiamine. B2 riboflavin. Mainly the lesions are mucocutaneous surfaces of the mouth and skin, and also itchy, irritated eyes and mucous membranes, and cropped corners of the lips, anemia, personality changes, and magenta color. Have to remember last లో ఉన్న డాక్టర్ తర్వాత మాట్లాడతాం. You have to remember magenta tongue. Magenta tongue is seen in vitamin B12 deficiency. You have to remember this magenta tongue. And also crack at the corners of the lips. You have to remember these two symptoms in vitamin B2. Coming to niacin. You have to remember niacin means B3. You have to remember 4 Ds: dermatitis, diarrhea, dementia, and death. Castle necklace is the prominent feature in niacin deficiency. This means rash around the neck. You have to remember this 2 Ds: dermatitis, diarrhea, dementia, death, and Castle's necklace, rash around the neck, and bright red glossitis. Magenta tongue is seen in B2 deficiency. In niacin, bright red glossitis we have to remember. Castle's necklace, 4 Ds, and bright red glossitis. Coming to vitamin B2, B6, sorry, pyridoxine. You have to remember the names of the vitamin B. First one, A1, thiamine, B2, riboflavin, B3, niacin, B6, pyridoxine. Due to pyridoxine deficiency, skin inflammation, peripheral neuropathy, depression and confusion, microcytic hypochromic anemia, these are the symptoms and signs. In infants, diarrhea, seizures, and anemia are the common features. Coming to B12, also called cobalamin. The signs of deficiency are tiredness and fatigue. The vitamin B12 deficiency mainly due to the absence of intrinsic factor. It is due to atrophy of the mucosa of the stomach. Main vitamin B12 deficiency is due to absence of intrinsic factor. You have to remember this absence of intrinsic factor. It is due to atrophy of mucosa of the stomach. The signs of deficiency are tiredness, fatigue, tingling, numbness in hands and feet, memory problems, and also pernicious anemia and megaloblastic anemia are due to vitamin B12 deficiency. You have to remember this pernicious anemia and megaloblastic anemia are due to B12 deficiency. And also you have to remember BP red tongue is seen in vitamin B12 deficiency. In this vitamin B12, we have to remember it is due to because of absence of intrinsic factor, that is due to atrophy of the mucosa of the stomach, and also pernicious anemia or megaloblastic anemia are due to vitamin B12 deficiency, and also BP red tongue is seen in vitamin B12 deficiency. We have to remember BP red tongue in vitamin B12 deficiency. Folic acid. The signs of folic acid are tiredness due to anemia. It is good for and also essential in the first 3 months of pregnancy to prevent the birth defects such as spina bifida, cleft palate, and cleft lip. We have to remember this to prevent which vitamin prevents the birth defects. Folic acid. You have to remember this. Which vitamin prevents the birth defects? Folic acid. Folic acid for preventing the birth defect. In vitamin B12, you have to remember BP retinal and pernicious anemia, megaloblastic anemia, and intrinsic factor. It is due to atrophy of the mucosa of the stomach. In B6, you have to remember B6 name pyridoxine. You have to remember pyridoxine. In niacin, you have to remember dermatitis, diarrhea, dementia, and death. And Gazer's necklace means rash around the neck, and the bright red glossitis. You have to remember. In B12, in B2, magenta tongue. You have to remember magenta tongue. In B2, B2 is riboflavin. In B1, you have to remember wet beriberi and dry beriberi, vernix encephalopathy. In wet beriberi, cardiovascular disorders, dry beriberi, peripheral disorders, and in vernix encephalopathy, this vitamin deficiency is seen in alcoholics. Magenta tongue is seen in vitamin B2. In vitamin C, we have to scurvy birds are the pathognomic feature of vitamin C, and the corkscrew tail is the feature of scurvy, and woody leg also is the feature of scurvy. You have to remember corkscrew tail, woody leg in scurvy. And also vitamin C is useful for wound healing. Vitamin K is useful for blood clotting. Vitamin E is the powerful antioxidant, and also it is useful for the fertility problems. You have to remember this during vitamin E. Because of vitamin D deficiency in children, the disease is rickets. In adults, osteomalacia. In vitamin A deficiency, we have to remember signs and symptoms. First sign and first symptom of the vitamin A deficiency. First symptom is night blindness, and earliest sign is conjunctival cirrhosis. How to remember all this? Is it audible now? Hello?
Yes, madam.
Okay. What are the signs of meningitis? Fever, headache, neck rigidity, and vomiting. What is Gerlich's sign? Cannot extend the knee from the flexion position when hip is flexed at 90 degrees. This is Gerlich's sign. Cannot extend the knee from the flexed position when hip is flexed at 90 degrees. What is Budensky's sign, neck sign? When neck is passively flexed, both knees and hip are flexed. When neck is flexed, both knee and hips are flexed. What is leg sign? When one leg is passively flexed, the other leg is also flexed automatically. You have to remember these signs in meningitis. The most common artery involved in stroke is middle coronary artery. The most common site of intracranial hypertensive bleeding is putamen. You have to remember epilepsy, types of epilepsy, and the syndromes and paralysis in epilepsy. What is Jacksonian epilepsy? Abnormal motor movements begin in a single spot and spread to the opposite side is called Jacksonian epilepsy. What is Tourette paralysis? Paralysis of the affected part after seizure is called Tourette paralysis. Psychomotor symptoms are seen in complex partial seizures. Olfactory hallucinations occur in temporal lobe epilepsy. Olfactory hallucinations are seen in temporal lobe epilepsy. Jacksonian epilepsy means abnormal motor movements begin in a single part and spread to the opposite side. Tourette paralysis means paralysis of the affected part after seizures. What is absent seizures or petit mal? Sudden and brief loss of consciousness without loss of postural control is called absent seizures or petit mal. It usually starts in childhood and or early adulthood. The continuous attacks of petit mal are called picmolepsy. What is dementia? Global deterioration of higher mental function is called dementia. In this, forgetfulness without depression and inattentiveness is seen. Forgetfulness without depression or inattentiveness. The most common cause of dementia is cerebral atrophy. What are the symptoms of third nerve palsy? Dilated pupils, divergent squint, and complete ptosis. These are the symptoms of third nerve palsy. Divergent squint is seen in third nerve palsy, and convergent squint is seen in sixth nerve palsy. You have to remember all the names of the nerves also. What is Hernet syndrome? Small pupil, partial ptosis, anhidrosis, and bloodshot conjunctiva. All these together called Hernet syndrome. You have to remember all these: small pupil, partial ptosis, anhidrosis, bloodshot conjunctiva. This is called Hernet syndrome. What is Archie Robertson pupil? It is due to pretectal nucleus of the midbrain. Lesion in the pretectal nucleus of the midbrain. It is Argent-Robertson profile. Accommodation reflex is present. Direct right reflex is option. We have to remember this. In Argent-Robertson profile, accommodation reflex present and direct right reflex absent. It is mainly seen in syphilis and also in diabetes and alcohol. Bell's policy. It is mainly due to facial nerve lesions. It is a lower motor neuron type. You have to remember what are the symptoms of lower motor neuron deficiency. What are the symptoms of upper motor neuron injuries? In Bell's palsy, pain about the ear and taste disturbances in the anterior two-third of the tongue. Pain disturbances in the anterior two-third of the tongue. What is Ramsay-Hunt syndrome? It is due to herpes zoster of the geniculate ganglia. Pain in ears with vesicles. The most common primary tumor of the CNS is glioma. You have to remember this. Primary tumor of the CNS, glioma. And also you have to remember most common primary site from which secondaries occur to brain. It is from lungs. Primary carcinoma in lungs and secondary carcinoma in brain. You have to remember these two. Primary tumors of the CNS, glioma. Most common primary site from which secondary occur to brain is lungs. In most common malignant brain tumors in children, medulloblastoma, in adults, glioma. The common symptom of brain tumor is headache. Parkinson's disease is depletion of the dopamine producing pigmented neurons in substantia nigra. You have to remember this. Depletion of dopamine producing pigmented neurons in substantia nigra. What is Lewy bodies? It is the hyaline inclusion in neurons are called Lewy bodies. Hyaline inclusion in neurons. Most common type of this disease is paralysis evidence. Coming to neurofibromatosis. It is autosomal dominant disorder. We have to remember all autosomal dominant disorders and all autosomal recessive disorders. What are the autosomal recessive disorders and what are the autosomal dominant disorders? And also you have to remember syndromes of genetic syndrome, Turner syndrome. Neurofibromatosis, two types. Type 1. It is due to gene defect, chromosomal defect of 17. In this, we have to remember von Dechine-Hazard's disease, Cape all out patches. These are the prominent symptoms in neurofibromatosis. We have to remember this. This is a very important point. Type 1 neurofibromatosis is a very important. Type 2 is due to gene defect. That is chromosome 22. In this, no cutaneous lesions, bilateral acoustic neuromas are present. How to remember this? have to remember all types of murmurs. Austin Flint murmur. It is due to atrial regurgitation. It is the mid-diastolic murmur seen in atrial regurgitation. Graham speed murmur is early diastolic murmur. What is Carly-Combs murmur? It is a mid-diastolic murmur of acute rheumatic fever. You have to remember this. Carly-Combs murmur. Gibson murmur or machinery murmur. It is seen in patent ductus or ileosis. Carvalho murmur. It is a systolic murmur seen in tricuspid stenosis. We have to remember in CBS murmurs and also what is biology of palate, what is tetralogy of palate, and what is pentalogy of palate. The biology of palate is pulmonary stenosis, ventricular septal defect, and overriding of the aorta. Pulmonary stenosis, ventricular septal defect, and overriding of the aorta. You have to remember. In tetralogy of palate along with right ventricular hypertrophy. You have to remember all this in tetralogy of palate, pulmonary stenosis, ventricular septal defect, overriding of the aorta, and the right ventricular hypertrophy. You have to remember all this in tetralogy of palate. What is pentalogy of palate? Along with hypertrophy of the atrial septal defect. What is Charcot's pruritus? It is fluctuating jaundice, recurrent pain, intermittent fever with rigors is called Charcot's pruritus. What is Murphy's pruritus? Pain in appendicitis. Pain is the first symptom. Vomiting next, fever last. We have to remember what is the first symptom in appendicitis. Pain is the first symptom in appendicitis. Pain, vomiting, fever. These are called Murphy's pruritus. In Charcot's pruritus, jaundice, recurrent pain, intermittent fever with rigors. What is portal hypertension pruritus? Splenomegaly, ascites, and esophageal varices are called portal hypertension pruritus. What is Saint's pruritus? Diverticulosis, gallstones, and hiatocelia. All these are called Saint's pruritus. You have to remember these three: diverticulosis, gallstones, and hiatocelia. These together called Saint's pruritus. In portal hypertension, splenomegaly, ascites, and esophageal varices. Anacotic pulsar, atrial stenosis, aortic stenosis, sorry. Pulsar seen in aortic stenosis. The eustachian valve is the rudimentary valve in inferior vena cava. You have to remember, eustachian valve is the rudimentary valve in inferior vena cava. What is Sebacean valve? It is at the opening of coronary sinus into the right atrium. Sebaceous valve is present at the sinus into the right atrium. Eustachian valve is the rudimentary valve in inferior vena cava. SCA node is usually supplied by the right coronary artery. Nodal cells are source of impulses in SCA node. Nodal cells are present in SCA node. Bachmann's bundle. It is the conducting system in atria. It is the conducting system in atria. We have to remember the what blood supply of the arteries. Right coronary artery, left coronary artery, circumflex artery. Which artery is supplied to the which part of the artery? You have to remember must. Rheumatic heart disease. It is caused by beta hemolytic streptococci. Ask of bodies is the pathological hallmark of rheumatic heart disease. It is seen in myocardium. Ask of bodies in myocardium. Neck column patch is seen in left atrium, and you have to remember this. Ask of bodies is a pathological hallmark of rheumatic heart disease. Neck column patch is seen in left atrium. It is caused by beta hemolytic streptococci. And also it is very important for examination. What is John's criteria in rheumatic heart disease? What are the major criteria? What are the minor criteria? You have to remember must. This is the frequently asked question. Major criteria in this: carditis, polyarthritis, chorea, edema marginatum, subcutaneous nodules. Carditis, polyarthritis, chorea, edema marginatum, and subcutaneous nodules. You have to remember all these five. And minor criteria are fever, arthasia, elevated erythrocyte sedimentation rate, and C-reactive proteins, prolonged PR interval. The minor criteria are fever, arthasia, elevated erythrocyte sedimentation rate, and C-reactive proteins, prolonged PR interval. Mitral valve is most commonly involved in rheumatic heart disease. Which valve is commonly involved in rheumatic heart disease? This is the question. Mitral valve is commonly involved in rheumatic heart disease. Bread and butter appearance seen in pericarditis. Bread and butter appearance is seen in pericarditis. What you have to remember vegetation also. What are the composition with vegetation? You have to remember the composition of the vegetation also. Okay. Bread and butter pericarditis seen in pericardium. Ask of bodies are seen in myocardium of the heart. Neck column patch is seen in left atrium. You have to remember John's criteria. Mitral valve is involved in rheumatic heart disease mainly. Coming to infective endocarditis, it is caused by Staphylococcus aureus, subacute by Streptococcus viridans. It is mainly seen in previously damaged valves. Mitral valve with normal orifice length is 4 to 6 centimeters. If it is less than 2 centimeters, it is called mitral stenosis. If less than 2 centimeters or 1.5 centimeters, the symptoms will also seen at rest. Tapping apex peak and parasternal heave, loud S1 are the hallmarks of the mitral stenosis. Opening snap occur after S2. Loud S1, opening snap after S2. Tapping apex peak, parasternal heave. Organisms associated with the CAD are chlamydia, pneumonia, cytomegalovirus, Helicobacter pylori. In atrial septal defect, ostium secundum is the most common type. You have to remember in atrial septal, commonest type is ostium secundum. In this condition, wide and fixed splitting of the S2 is there. In ventricular septal defect, pansystolic murmur is seen. Pansystolic murmur is seen in ventricular septal defect. In patent ductus arteriosus, continuous murmur or missionary murmur or Gibson murmur or train in tunnel murmur is seen. Coarctation of the aorta. In this condition, hypertension in the upper segment is seen. It is the main important feature in coarctation of the aorta. Hypertension in the upper segment means upper body, that is upper limbs. Hypertension in the upper limbs. And femoral artery pulsations are delayed and weak. And erosion of the erosion of the lower border of the ribs takes place in the coarctation of the aorta. This is called Dock's sign. Dock's sign. Erosion of the lower border of the ribs is called Dock's sign. Figure of 3 sign is seen in coarctation of the aorta. Cardiomyopathy. Dilated cardiomyopathy and hypertrophic cardiomyopathy. Most common type is dilated cardiomyopathy. Sudden death is seen in hypertrophic cardiomyopathy. Embolism is common in dilated cardiomyopathy. Double apex in hypertrophic cardiomyopathy. Sudden death and double apex beat is seen in hypertrophic cardiomyopathy. Commonest form is dilated cardiomyopathy and embolism is seen in dilated cardiomyopathy. Most common primary tumor in the heart is myxoma. It is most commonly seen in left atrium. No time to prepare PPT for other systems. You have to remember, we will discuss orally. You have to remember what are the clotting factors and what are the diseases of deficiency of the clotting factors. You have to remember. What are the X-linked recessive disorders and what are the X-linked dominant disorders? You have to remember all this. And also, what are the syndromes? For example, what is the Down syndrome? What is the Klinefelter syndrome? What is the Turner's syndrome? And also in nephropathy, you have to remember the types of glomerulonephritis and what is the nephrotic syndrome and what is the nephritic syndrome. You have to remember what are the components of nephrotic syndrome and what are the components of nephritic syndrome. What are the symptoms of nephrotic and nephritic syndrome? The commonest organism causing urinary tract infection is Escherichia coli. And also you have to remember hypersensitivity. What are the types of hypersensitivity reactions? What are the examples of hypersensitivity reactions? And also speeches, types of speech, and also which lesion affected speech, which type of speech. You have to remember this also. For example, scanning speech, Broca's aphasia, Wernicke's aphasia. What are the causes of this? You have to remember. And also in nervous system, what are the lobes in the brain, and also what are the symptoms of the lesions of the lobes. You must remember this also. The lesions of the lobes, symptoms of the lesions of the lobes. And also gait. You have to remember gait. Which gait is in which disease. You have to remember. The commonest cause of septic arthritis in infants is Haemophilus influenza. You have to remember. Commonest cause of septic arthritis in infants is Haemophilus influenza. Rubbed out appearance in joints is seen in septic arthritis. Rubbed out lesions is seen in septic arthritis. Causes swelling of the fingers are seen in systemic sclerosis. Mask face and big nose are features of the scleroderma. Causes swelling of the fingers is seen in systemic sclerosis. Masked face and Greek nose are the features of the scleroderma. Heliotrope rash on upper eyelids is seen in dermatomyositis. Dermatomyositis. How to remember endocrinology also. What are the symptoms of hypothyroidism, hyperthyroidism, what is the acromegaly, what is the hypersecretion of the pituitary hormone causes which diseases, and hyposecretion of the pituitary hormone causes which diseases. You have to remember all the diseases of the endocrine also. What are the symptoms of acromegaly? What are the symptoms of Graves' disease? What is Vixedema? How to remember all these symptoms? What is Addison's disease? What is Vixedema? What is acromegaly? What are the symptoms of these diseases? You have to remember all the symptoms and signs of these deficiency disorders. In nephritic syndrome, proteinuria, hypertension, edema, uremia, and RD are the prominent features. In nephritic syndrome, hematuria, proteinuria, hypertension, edema, uremia, and RBC gas. In nephrotic syndrome, heavy urinary protein loss is seen in nephrotic syndrome. And hypoalbuminemia, edema, hypercholesterolemia. Hypercholesterolemia are the nephrotic syndrome features. We have to remember nephrotic syndrome and nephritic syndrome. What is group posture syndrome? We have to remember nephropathy, group posture syndrome. We have to remember all types of glomerular diseases. In dermatology, you must read the previous questions of dermatology, and also you must read the previous question papers of the MBBS MD entrance examination. Previous question papers of the MBBS MD entrance examination question papers must read. And also to remember the stones of the renal stones. Radiolucent stones are uric acid stones. Radiolucent stones are uric acid stones. Spiky stones are calcium oxalate. And the smooth stones.
Madam, slides are not visible, madam.
No PPT because of the shortage. Radiolucent stones are
Only important
Yes,
points
madam.
is madam. Ah, yes.
only I am telling important points only. Radiolucent stones are uric acid cariclite, spiky stones are calcium oxalate, smooth stones are calcium phosphate, Stockholm stones, triple phosphate stones. Stockholm stones are triple phosphate stones. We have to remember this. Spiky stones, smooth stone, Stockholm stone, radiolucent stones are uric acid cariclite. And also you read the infections. What are the commonest symptoms of the infection? So which organism, which disease is spread by the which vector? We have to remember. In typhoid, Peyer's patches are commonly involved organs of the intestine. Peyer's patches in typhoid. And also rose spots are seen at the first week of the typhoid. Rose spots are appear at the end of the first week. For Salmonella typhi, first week it is detected by the blood culture. Second week by the Vidal test. Third week by the stool culture. This is the diagnostic test for Salmonella typhi. First week blood culture, second week Vidal test, third week stool examination. And also you have to remember What are the carcinomas and viral infections seen in HIV? That is AIDS. What are the common infections in AIDS? What are the common neoplasms in AIDS? What are the non-tubercular mycobacterial infection in AIDS? What are the fungal infection in AIDS? We have to remember all. The secondary neoplasm in AIDS are Kaposi sarcoma, non-Hodgkin lymphoma. Common infection in AIDS are cytomegalovirus, virus, mycobacterium, avium, mycobacterium tuberculosis, mycobacterium intracellular, toxoplasmosis, and histoplasmosis. What is the cause of blindness in HIV? Cytomegalovirus is the cause of blindness in HIV. Most common fungal infection in HIV is oral candidiasis. Commonest cause of meningitis in AIDS is Cryptococcus neoformans. Commonest protozoal infection in AIDS is Toxoplasma gondii infection. Yellow fever caused by flavivirus and councilman bodies are the diagnostic feature for yellow fever. You have to remember councilman bodies. It is caused by flavivirus. Yellow fever caused by flavivirus. Hyaline deposits are seen in yellow fever. And also, you have to remember what is leishmaniasis, what are the type of trypanosoma, type 2 leishmania, type 2, what are the symptoms of leishmaniasis, what are the vectors of these infections, you have to remember. What are the airborne diseases, what is the droplet infections, what are the water infections, what are the zoonotic diseases, you have to remember this also. What are the zoonotic diseases? Which viral infection has been eradicated with smallpox? And also you have to remember the distribution of the rash also. In chickenpox, rash appear first on the trunk. Centrifugal distribution. In chickenpox, rash has a centrifugal distribution, means center to periphery. This is called centrifugal. First appear on the trunk. In centripetal distribution, first appear on the peripheral parts and next spreads to the center. It is seen in measles. Centripetal. In measles, rash appear at the ear. Starts to rash appear at the ear. organism causing hairy leukoplakia in AIDS is Epstein-Barr virus. In chickenpox, rash appear on the second day of the fever. Second day of the fever. Rash appear on the second day of the fever. Chickenpox also called varicella. And also you have to remember plasmodium. What is plasmodium vivox incubation period? All types of plasmodium and what are the incubation period of these types of plasmodium. Flask-shaped ulcers are seen in amoebiasis. You have to remember this. Flask-shaped ulcers are seen in amoebiasis. Pain is seen in right iliac pain in amoebiasis. And also you have to remember syphilis and leprosy. What are the types of syphilis? What are the types of leprosy? And what are the examples and clinical features of the types of leprosy? Malignant pursuits are the features of cutaneous anthrax. Pale stools are feature of giardiasis. Pale stools are feature of giardiasis. You have to remember Kala-Azar disease. What is the cause of Kala-Azar disease? Sleeping. You have to remember sleeping sickness also. These are previously asked questions. What is the vector of filariasis? What is the vector of Plasmodium? You have to remember what is the vector of dengue fever. Nowadays we are suffering with coronavirus. You have to remember this also. Painless hematuria is seen in cysticercosis. You have to concentrate on AIDS, HIV, commonest organisms and commonest infections in AIDS. And also you have to remember the malignancies, which part is affected by which malignancy and common malignancy in all organs. And also tumor markers. And food poisoning. What are the causative organisms for food poisoning? You have to remember that also. What is the commonest cause of avoidable blindness in the world is trachoma. What is the commonest cause of avoidable? You have to remember avoidable blindness in the world, trachoma. Step ladder pyrexia is typhoid caused by Salmonella typhi. You have to remember, yesterday I discussed about occupational disorders. What is silicosis, what is diagnosis, what is piscinosis. You have to remember this also. Pink puffers are seen in emphysema. Blue blotters are seen in chronic bronchitis. You have to remember, pink puffer is seen in emphysema, blue chronic bronchitis. And you have to remember the myocardial infarction. In myocardial infarction, which enzymes are first raised? Within 24 hours, CPK is raised. After that, ASC. After that, LDH. And also you have to remember which lead is involved in which type of infarct. In anterior, infarct V3 and V4 and V2 and V5 also involved in anterior infarct. Anteroseptal infarction V1, V3, V1 to V3. In later infections, lead 1, 2 and AV1. In inferior infection, lead 2, 3 and AVF. In posterior infection, V1 and V2. We have to remember this also. CPK is first raised. It peaks in 24 hours and normally 48 hours. AST peaks in 48 hours and normally 72 hours. LDH peaks at 3 to 4 days and remains elevated up to 10 days. You have to remember this also. And also ECG, once you read ECG also. And also you remember what is acidosis, what is alkalosis. onion skin lesions are seen in SME. You have to remember the blood supply of the brain and blood supply of the heart also. And also cranial nerve palsy. And also you have to read what is illusion, what is delusion, what is schizophrenia, what is OCD. And also you have to remember ringworm infection. What is Tinea cruris, Tinea carboris, Tinea capitis, and Tinea pedis, Tinea anguinum. Tinea cruris involves the groins. This is previously asked question. Tinea cruris. It affects the groins. Tinea corporis, trunk, face, and extremities. Tinea capitis, uh, scalp. Tinea pedis, foot. That is called athlete's foot. Tinea angulinum, nails. Now to remember, tinea cruris for groins, tinea corporis for neck, face, and extremities, tinea capitis for scalp, tinea pedis for athlete foot, tinea angulinum the nails. You have to remember this. Cognitive phenomena is seen in psoriasis. Chancroid is caused by Haemophilus pylori. Now to remember what are the anaerobic organisms, what are the aerobic organisms also. And also what are the gram negative bacillus and what are the gram positive bacillus. aerobic, anaerobic, and also gram positive and gram negative bacillus also you have to remember. Patch test is used for contact dermatitis. Freeze test is used for lymphogranuloma venereus. Lymphogranuloma venereum is caused by Chlamydia trachomatis. Lupus vulgaris is TB of the skin. Is called lupus vulgaris. TB of the tuberculosis of the skin is called lupus vulgaris. Leprosy other name is Hansen's disease. Lepromin test is used for leprosy. You have to remember types of the primary, secondary, and tertiary syphilis. Chancre is the characteristic feature in primary syphilis. Gammata is the characteristic feature in tertiary syphilis. VDR test is used for the detection of the syphilis. What are the false positive VDRL tests are? Lepromotus leprosy, malaria, tropical eosinophilia, SLE, rheumatoid arthritis, which also gives false positive VDRL test.